Season 2 of the Pat and JT podcast.
Oh man, I'm here at last. The best time, always gonna be the best. Come on!
Exclusively on the Parkville Network.
Well, all right.
It's Pat and JT on Facebook, Instagram, and Twitter. Also, 402-403-9478. Appreciate you liking, subscribing, and downloading our podcast.
I'll let you go ahead and do the introduction because, you kind of set this up. So,
Well, yeah, actually, Heidi kind of set it up because she gave me his phone number. Taylor Wilson is on with us from Nebraska Medicine, and we've known Taylor for a long time. Used to be an anchor at Fox 42 and moved on to and actually got a legit real job, unlike us broadcasters. And now, Taylor, we're all really super proud of the work you guys are doing at Nebraska Medicine in helping fight Corona right now.
And before you go forward, what exactly is your position?
My official title is Media Relations Senior Coordinator for Nebraska Medicine, but it is a real job, especially when things like this happen.
Right.
So I do appreciate you having me on, but in this capacity, I'm actually kind of the spokesperson for both Nebraska Medicine and UNMC going forward. So anything that happens related to coronavirus, I'm the spokesperson. However, I don't get a lot of opportunities to do interviews. Usually it's the folks wearing the white coats and have MD after their name or our nurses who get to do it. So I appreciate the opportunity to speak to you about this today.
Absolutely. No, I'm glad you're here for us, and you're somebody we're familiar with, and a lot of the listeners too are going to recognize your voice the minute they hear it. So how long have you been working with Nebraska Medicine?
It's been like 9 years, by the way, since TV for me. I can't
That's
believe
crazy.
That is insane. 9 years?
Yep, nine short years, actually.
Yeah.
Right.
Well, okay. So what other, before we jump in on coronavirus, then you've been there for a couple other situations.
Ebola was the other main situation in 2014. Right. We had a patient in September, one in October, and one in November of 2014.
Right. All right. So let's talk about where things stand right now with Nebraska Medicine and coronavirus, and how many patients and what
Sure.
is going on.
So we have 15 people here that we're monitoring, who all are former passengers of the Diamond Princess cruise ship that was docked off the coast of Japan. They came here on February 17th, 13 of them did. Then we added one more earlier this week, and then another a day or two after that. So a total of 15. The folks that we added are spouses of people who were already here. So we kind of had reunification, so to speak, putting everyone together.
So, and that was because were they also potentially infected as well, or you just brought them just for like?
Yes, all these people came in from the cruise ship. One was in California at the air base there in quarantine. One was at the air base at Texas outside San Antonio.
Got it.
So they both came over on the flights from Japan, and so 15 total now. 2 people testing negative still. So if those folks remain healthy, remain negative, they could leave quarantine as early as the morning of March 2nd.
Is it a usually 2-week quarantine that they were looking at? I'm referring back like
who remain negative. It's a 2-week quarantine, much like the folks we had come in prior to this, the 57 folks that were monitored at Camp Ashland.
Yep, that got my attention to come from Ashland. And it was like,
Sure.
what? They're doing what? What's going on out there?
Yeah, and that went so well. We had one person who showed some minor upper respiratory symptoms. They came to us for testing. They had 2 negative tests 24 hours apart. They went out and finished the rest of the quarantine, and then everyone went home healthy and well and back living their lives around the country.
Now, don't the symptoms kind of mimic that of just the regular flu? So how do people know what the difference is between corona without a test, actually?
Sure. The primary symptoms, from what I'm being told now, I don't want to sound like an expert here because obviously I hang out with these doctors, but did not spend near the amount of time in school as they did.
You're more experter than us.
Upper respiratory symptoms. So colds and like symptoms, sneezing, fever is a main symptom. From what I'm hearing, we don't get the body aches like you do typically with the flu. So I do want to emphasize, though, the things they tell me that are 80 to 90% of these cases that we've seen so far are mild cases. So for most people, and including our folks that we've had here in quarantine, the symptoms are mild or no symptoms at all. It's for the folks who may have coexisting conditions or may be a little bit older that the symptoms could be a little more severe.
Yeah, some of the numbers that we'd seen, we're talking about most of the cases, about 75% were actually in the province that Wuhan is in China. That's like the majority of the cases. So you've got a sprinkling of other cases around the world that are coming in, but it's causing a lot of panic in some cases. It seems like they're calling off or closing down some cities in Italy, and they're calling off concerts, and they're ultimate cautionary tale. They're just like, you know what, we're just going to stop everything until we get this taken care of.
Sure, and I think the main concern now is the case that popped up outside Sacramento that has no known origin. We don't know how that person got infected. There was no travel involved. That person is in the ICU at UC Davis as of the time that I'm saying this.
Okay.
So that means there's got to be someone else in the community that, if all reporting methods are accurate, that somehow infected this person and didn't know about it, had mild symptoms or no symptoms, and now that person is still in the community and possibly doing the same thing. So that's where the concern starts, because if it does start in that in an area and is unmonitored and untrackable, then you start to have concerns that community spread could become a concern.
And you're talking about travel, and I don't know, not necessarily this may not be your information, but what you're hearing. Travel concerns. My brother and his family are going on a cruise in the middle of March, and he's kind of really starting to think about, is this something that I want to risk? Do I want to utilize the insurance that we got? I mean, what's the advice that you're hearing from doctors on this?
It definitely varies, because my daughter has a volleyball trip scheduled. She plays for the UNK volleyball team. They were going to go to Italy in May.
Oh. That's
very much up in the air. I have colleagues who have family are in Spain right now and planning to go to Italy this weekend. So the advice is very much variable at this time. Depends on the part of the country or the part of the world you might be going to. It's hard to provide accurate information. Obviously, China is off limits, and some areas of Asia, but parts of Europe are now starting to heat up a little bit. So as far as advice goes, we can't really provide concrete, solid 100% advice, because it's just such a variable situation right now.
Yeah. Now, the number of cases, we mentioned the flu earlier, and I think this is something that a lot of people are, because there are two different sets of numbers that come out when you start talking about comparing it with the flu, is the number of people who have died. And obviously the number for flu victims is much higher, but that's because many more people contract it. And so it's much higher. Percentage-wise, there is a difference. It's not a huge difference, but it's significant when it comes, I'm sure, to the world of medicine, the percentage.
Right, and we have some pretty smart people here, so I tend to believe them when I listen to them speak.
Exactly.
And even since Ebola, we've just added such a cadre of infectious diseases experts from the WHO and CDC, and people who have been doing this for a living for a very long time, who've wanted to be a part of what we're building here at Nebraska Medicine and UNMC. So it's good to have them right next to me, and I get to hear the things they're talking about as far as infection rates and mortality rates and things like that. So from what I'm hearing, they believe as this continues to progress that the mortality rate will be less than 1%, maybe 0.5%, still a lot higher than the flu, which is probably less than 0.1%. So mortality rates are still a concern, even though they're really low. If you think, 0.5% or 1% of the population, that's still a pretty large number if we start seeing those types of things happen.
The numbers, yeah. I know a lot of people, 15 to 20, I think they said centers are working on vaccines, trying to find trying to figure out what they're going to need. There was even a report coming out, and it just came out today, I believe, as a matter of fact, about in Israel, that they were working on something else, and they just coincidentally, it was like a stroke of luck that they were using the coronavirus as part of their testing. Did you hear about that?
Yeah. As far as vaccines go, I don't have a ton of information, because that's not something we're involved with here. What we are involved with is the first clinical trial on a therapeutic to fight COVID-19. So it would be an injectable drug. If you are suspected, or if you've tested positive for this drug would be injected into you to perhaps alleviate the symptoms or eradicate it altogether. So this clinical trial just started. The first patient was enrolled here at UNMC, and so that is underway. Started a few days ago. What we don't know is, with these sorts of trials, it's what's called a double-blind trial, which means the people involved even the doctors administering the medication don't know if the patients are getting the real thing or a placebo. But we do have one person here enrolled in the trial. That person has started off in our biocontainment unit, which is for a higher level of medical care where our patients with Ebola were. He has improved. He's now in the national quarantine unit. We don't know if he received that drug or not, but our folks have been speaking to media worldwide about our involvement in this clinical trial that will hopefully be of help as this disease progresses.
Wow. So what these people that are in quarantine, like how many luxuries do they have? TV, I'm assuming they get as much food as they want,
Sure.
like totally just trash it up for food, and like do they get kind of carte blanche, whatever they want?
Or is there a recommended diet?
Requests for food. Yeah,
Okay.
that's one of the things that and we're trying to accommodate as many requests as we can. So the national quarantine unit is relatively new. It just opened in a building here on campus just a few weeks ago.
Oh, really?
The building itself will be serving a number of purposes, and the rest of the building won't even open until April. So fortunately, we have this space available for these folks. It has 20 beds, which is 20 individual rooms. They're very similar to dorm rooms or a hotel room. A bed that's not a hospital bed, so it's more of a regular bed. Good size room, exercise equipment, Wi-Fi, television, window, so they can see the outside world. They just can't go into the outside world. So the accommodations are much better than a hospital room than the folks who were in the biocontainment unit were experiencing. But now all of our folks in the quarantine unit, all 15 of them, and so they also get together every day at 3:00. And we have a virtual town hall, where they all get to talk to each other.
That's
they
awesome.
Talk to our providers and kind of learn about what's working and what's not working and how to best cope and get through the quarantine.
That's interesting that you do. Is that something people can access?
No, it's private, just for our folks and for our providers and healthcare professionals. We have some behavioral health folks that talk about mentally how to best cope in situations like these, and I've been able to hear them. It's just great to hear all the stories the folks are telling about how they're getting through it, and overwhelmingly positive stories from them about their experience with our staff. So we're always happy to hear it when things are going well.
That's great having that kind of feedback, like right real time. Like this isn't working. This is awesome.
Whip your vision into shape right there, yo, with Kugler Vision. We love that they're a supporter of our podcast.
Absolutely. They've got some great things that are happening on their website. If you haven't been there recently, at kuglervision.com. It already was so user-friendly if you'd thought about having any of the procedures done. And so many different procedures. It's not just one procedure, one size fits all. But interestingly, you'll find over 600 five-star patient reviews, which is amazing. The number of people that are taking advantage and saying, you know what? 2020 is going to be my year. And I think there were a couple of them that were talking about making improvements, that 2020 is the year. Right?
Yep.
They're ready to go. And one of the first ones was vision.
I said what Gary said too. Dr. Kugler's office is amazing. They are amazing because you have cookies and they have delicious flavored waters.
They do.
Oh, and then they're also great doctors too.
And that too, don't forget. They said that the staff made the procedure a breeze. That's from Natalia. I especially enjoyed the surgery prep in a massage chair, covered by a blanket, drinking some tea. I was relaxed, anxiety gone. I wish I'd done this years sooner. Now, to make it even simpler, you can text them. The number to text is 72000. You want to text C Omaha, 2 words, to 72000. I did that. And you will get back a response that will first ask you to confirm. So I text back yes. And then it sent me a link. And when you go to the page, it, of course, welcomes you. And then it's got some real quick questions about what it is that you're looking for. And then I got a follow-up phone call real quick. And super nice. Nicole called, and she's there just to make sure that you got the information you wanted. And if you had any further questions, she was there to help you out.
Get that consultation now at Kugler Vision. You can also go to kuglervision.com.
And tell them Pat and JT sent you.
I mean, think about these people. They went on this vacation and they had no clue they were going to spend a couple weeks in Omaha, Nebraska afterwards. So their lives completely flipped upside down. So they've got to be, what is going on? So the fact that you have doctors that can talk them through those situations, how difficult would that be? That'd be so hard.
Or change their situation.
Or change, right.
It's got to be better than you think about somebody going on a trial as a juror and ended up being sequestered.
Yeah.
You hear the horror stories about that.
Yeah. So, these folks are are making requests to our staff, and we're trying to accommodate every possible request we can. I know folks are ordering things on Amazon, and the packages are coming in, and so we're delivering.
Okay, wait a minute.
That's awesome.
I got to ask you something about that, because there is a rumor floating around. Let's just say that somebody brought up that if you're getting your packages, how many of these packages come from China? Number one,
Right.
And if you're getting the bubble wrap, don't pop the wrap because the air's from China.
Yeah, I've never heard that. And
You aren't following the same people I do.
They've commented on the Chinese package thing and said that's really not a concern. Yeah.
Okay, that's
But
good to hear, though.
I don't know what they're ordering. I just know that they're happy getting the things they're getting. I do know they had problems with luggage, so even you lose luggage on quarantine flights, apparently.
Oh, really?
Many of our folks got here without any luggage. Almost all of it has now been recovered.
Wow.
But even in this situation, luggage can be lost.
Yeah.
Wow. Talk more about, UNMC, or Nebraska Medicine, just on the world stage. Where do you guys sit in, and what's like you guys that's out there? I mean, what other countries or facilities are similar?
Well, this is certainly a collaborative effort between UNMC and Nebraska Medicine. And as far as a national quarantine unit goes, we're the only federally funded unit in the United States.
Wow.
So it's a 20-bed unit, and it's the only one of its kind. I know that Emory University in Atlanta has a biocontainment unit that was used during Ebola in 2014. And so they would obviously have capacity for something like this. But since Ebola in 2014, hospitals in several different regions across the country have set up biocontainment units so we can handle issues like this on a regional basis if necessary. Now, I will say if this disease progresses like it's predicted to, then biocontainment units really wouldn't be appropriate to care for this number of patients, because we just wouldn't have the space to do it. They'll be cared for in a normal hospital setting. But these sorts of facilities have started to pop up and become more prevalent because of our efforts and Emory's efforts with Ebola in 2014.
So does it seem like we're kind of, you guys, obviously everybody's doing what they can to stop it, but is it kind of just delaying the inevitable that the disease is eventually going to get to the United States, it's going to get to other countries and just kind of work its course?
Like you said, what are the predictions?
Yeah, that's the message from the CDC, is it's not a matter of if, but when. So I think we need to start thinking that this could become more likely, that we're going to have community cases of this just pop up like they did with the first case in California. But the important thing to emphasize is we just need to have preparation and not panic. I know Nebraska Medicine has a pandemic plan that we worked on several years ago. We brought it out a couple months ago to review it, to make sure we had everything in line. And just yesterday, we brought it to the table again and have teams starting to work on what it's going to look like, should we need extra capacity, extra beds, extra equipment, things of that nature. So we are in progress of making sure that we can meet the needs of the community as best as we possibly can. Of course, it will be a team effort with all the providers across Omaha. It wouldn't be realistic for us to be able to handle all cases of this should it become something that turns into a situation where there are multiple cases. So all of the healthcare providers in Omaha will have to band together, and will need to work together to address this if it becomes more widespread.
Is there a consensus on how this got started? I mean, there's talk of it was the China markets, it's bat soup, it's lab.
So the thing that I'm
lab-borne.
hearing is it may have started with bats. The thing that I think people aren't hearing as much is there was an intermediary animal between bats and humans, and it's a small armadillo-like creature called a pangolin.
I did hear about that, yeah.
I think could be responsible. It was actually National Pangolin Day just a few weekends ago. I can't remember the day.
Seriously.
I don't have it on
Throw
my
it in our face,
calendar,
pangolin.
basically enough. But they think that could be the culprit right now. Obviously, more research will need to be done, but they do think it started in bats, went to pangolins, and then jumps to humans.
Interesting. Yeah, because obviously the internet goes crazy. It's bat soup.
Right.
It's like, and then it's laboratory born, and so you wonder about those things.
Either way, bat soup's just a bad idea.
I'll tell you, like I said, I sit next to some really smart people and people who are very much plugged into this event. Mm-hmm. And I will say I never hear any of those crazy things mentioned.
Good.
You just don't follow the right people.
You got to spend more time on
Taylor.
Twitter, Taylor.
Seriously.
I spend time on Twitter. Trust me, I see it. And I'm very thankful for the goodwill we have out there.
Yeah.
It is
Oh my
very
gosh.
tangible, and we're very happy to carry that flag and hope to continue to be able to do it. But
Pretty cool.
The scientists and doctors behind this here at UNMC and Nebraska Medicine are only talking science and not talking about those things. And if we don't trust science and we don't trust these people, I don't know who we should trust.
True.
Very good. Now let's talk prevention. Then another internet possibly rumor. I know I saw a couple of news stories about it. On Lysol, cans of Lysol or Clorox, coronavirus is listed as one of the germs or the germs that cause coronavirus can be eliminated on surfaces. Sure. It sounds like it's more complicated than the simplicity of that statement.
Well, a lot of people talked about that and said, well, this disease has obviously been around for a long period of time. And it's true. Coronaviruses have been around for a while.
There's more than one.
They cause the common cold. So that's what people are referring to on those warning labels or the explanations that are on those bottles of Lysol or Clorox. So when people see that, they should realize coronaviruses have been around a long time. This one is just a different coronavirus. And, it could be possible. I was talking to Dr. Mark Siegel came to campus. He's the Fox News medical correspondent. And I asked him, could it be possible if we develop a vaccine for this? Could it be possible that we get a vaccine for this along with the seasonal flu vaccine? And he said, yeah, it could be possible. It could be something that once we develop the vaccine, we'll just get our shot for this one and we'll get our shot for seasonal flu, and then we'll be covered until the next thing.
That's
right.
cool.
Right. We just got to get over the hump of figuring all the other stuff out in between.
That's what you guys are doing. I just love the fact that it's here. It's at
I do
home,
too.
and that the world's attention is on the people that we have here in Omaha and in Nebraska, and it makes you very proud. It really does.
There were a couple of stories. National commentators had trouble pronouncing the word Omaha.
It's like, where are you from?
I mean, seriously, I was like, have you not said Omaha ever before in your life?
Really? I've
Omaha.
not heard that. How do we pronounce Omaha?
Omaha.
Omaha.
It was like
What?
the emphasis was on the wrong syllable or something, and I kept hearing it on one of the national. I'm like, what is wrong with this? It's Omaha.
We are still flying under the radar to some degree. I would say that we've had a lot of national attention and done a lot of national interviews and had some folks on campus. But, it's just kind of how Nebraska is. We just kind of do the work and get the job done. And that's what our folks are trying to do. Just stay focused and provide a great service to the community. And at the same time, helping out with this world issue right now.
So before we say goodbye, just on a day basis, is it just as simple as wash your hands, cover your mouth when you sneeze or cough?
Yep. So best advice I've heard is the first thing is the main concern with this virus is someone coughing on you, sneezing on you, breathing droplets directly on you, face, eyes, mouth, nose. So that's the main way it's transmitted. To a lesser degree, it's contact with surfaces where the virus lives. So if someone sneezed on a table and you touch the table, then touch your face. So that's a lesser concern, but still a concern. So the thing that I'm already starting to do is practicing not touching my face, because you get tired at the end of the day and your eyes get dry and you rub your eyes. And that's probably the way the majority of us get colds and the flu. So start practicing that now. Be cognizant of when you do it. And then in addition to that, practice good hand washing technique right now. You have to do it for at least 20 seconds.
Jeez.
People say sing the ABC song.
So long.
That's it.
The right way. You have to wash the thumbs like this. You have to interlock the fingers like this. You have to get the backs of the hands like this.
Yeah.
So that's something I'm already doing right now. And I think a lot of us, if we just start doing that and start practicing it right now, it will go a long way.
Okay. Is there one soap above another?
I haven't heard any preferred soap. I did hear with hand sanitizers, I've heard 60% alcohol or more.
Okay.
Ooh.
Very good. Superman, thank you so much.
Anything less than that, but that's what I heard.
Well, that's interesting because there was a story about hand sanitizers, and it mentioned that fact that a lot of the hand sanitizers that people buy are totally ineffective. And it's like
Really?
Hand washing is still preferable. Hand washing is still preferable
is number
before
one.
meals and as often as you can.
Absolutely. There you
Taylor,
go.
you're awesome, man. Thanks for taking the time to talk to us today for so long. We really
This was
appreciate
fun. I
it.
enjoyed it. It makes me sound really smart. I'm just listening to smart people.
Man.
See, it's all about the people you surround yourself with.
That's right.
Right?
It's true. That's
right.
It makes you really smart. But It's just memory. That's all it is.
You did great. Thank you so much. And hopefully we get a chance to talk to you again and get to hear some great updates.
Sure. No
All right.
problem. Happy to do it.
Thanks, Taylor.
Thank you.
Have a good one. We'll talk to you later. We'll see you. So wash your hands more is basically
Wash
what
your
Taylor's
hands.
saying. Wash your hands.
But don't touch your face.
Dang it. I always touch my face.
A
I don't
lot.
think you get sick through your eyes.
You really do.
A lot.
I know.
I love my face. Have you seen my face? I love touching my face. Especially after shave day.
Oh, my God.
All right. Thanks, Taylor. Pat and JT.
Pat and JT Podcast, a Parkville Media Production.